Hello everyone, I am Dr. Manbir Singh Khurana. I am an interventional cardiologist at Mediways Hospital, Ludhiana. Today I'll be talking about how to manage hypertension and how to achieve our blood pressure goal. So first and most important thing is that what is hypertension? As most of you must be knowing, hypertension is actually increase in our blood pressure readings. Blood pressure is basically the pressure with which our blood flows into the arteries, and it is the increase in blood pressure leads to a lot of problems chronically. It will not cause any symptoms to you immediately, but it has been seen globally that more than 10.4 million deaths per year are caused because of hypertension. And the real world evidence would be much more, because most of the data actually is not collected. So hypertension is actually one of the biggest and the most dangerous disease, which if we control it is nothing, and but if we don't control it can lead to some serious complications like stroke, heart failure, eyes problems, like you can have a retinopathy, kidney disease. So all these things are associated with hypertension if it is not controlled for a long time. Although its prevalence is increasing, many of the patients, they are underdiagnosed and undertreated. And it has been seen that once we stop the treatment, the patient suddenly presents with a lot of complications. Managing a hypertension is one of the most crucial and important part of any physician's choice, as well as for the patient if he or she is having hypertension. The primary aim is to control the blood pressure in order to prevent, reverse, or delay any progression of complications, thereby reducing the overall risk of individual and without compromising any quality of life. We see many patients who come to in the emergency with sudden history of large stroke, massive stroke, and after that nothing can be done. Most of the people cannot do anything. There is no science beyond that. If you have suffered a major stroke, and you must have also heard that patient suddenly died of a heart attack, all these things, they have a precursor, and hypertension is actually one of the precursor of all these things. And if it is controlled, then we can prevent a lot of these complications. So my focus will be how to manage hypertension and how we can achieve a blood pressure goal. Basically, whenever there is a hypertensive, we divide the patient in a low risk category, medium risk category, and a high or very high risk category. The low risk patients are those who do not have other comorbidities apart from hypertension, like the diabetes or having obesity or a strong family history and smoking history. So, if the patient or history of heart disease is in the past, so if any of these is present, then the patient becomes a high risk category. But if all of these things are absent and patient is relatively young, then the patient is considered a low risk patient. So in those low risk patient, it is always prudent we first start with the lifestyle modifications, and we observe the patient for every 3 months to decrease the blood pressure. It is we do not start the therapy immediately with the medicines, and we wait for 3 months to see how the patient behaves with the lifestyle modification. The details of these lifestyle modification I'll tell you further on. And what we do in the medium risk patients is we monitor them a little bit more closely. Like we monitor them on a monthly basis as compared to 3 monthly basis, along with lifestyle modification. And if the blood pressure is still remaining more than 140 by 90, that is 140 the higher blood value, systolic blood pressure, and 90 the lower value, that is diastolic blood pressure, then we have to initiate a drug therapy, or we call as medicines. And in those patients who are very high risk, immediate drug therapy for hypertension and other risk factors is important, because we do not want to have any further complication in all these high risk patients. So this is the categorization of blood pressure. Then what is important is that how do we diagnose blood hypertension? Mostly in our kind of setup in India, blood pressure is diagnosed when the patient visits the clinic for some reason. Sometimes they have headache, sometimes they have fever, sometimes they go for some other complaint, and blood pressure is incidentally found to be high. And it is very important to know that blood pressure, most of the times, more than 95% of the cases, it will not cause any symptoms. Even if the blood pressure is going beyond 160, many of the patients will say we don't feel anything. And this is a normal phenomena, because hypertension is basically a silent disease. It will not cause you symptoms, and it will only cause symptoms once you have developed complications. So it is always better to check your blood pressure beforehand, and after, once you have reached certain age, like you have reached 40 or if you have a strong family history of hypertension, your parents are having high blood pressure, then you can start even early, that you should check your blood pressure at least once a year if it is coming in the normal range. It is always prudent that the blood pressure is mostly diagnosed in OPD clinics than when the patient reaches for medicines. But it has also been seen that many times once the patient reaches the clinic, blood pressure spontaneously increases because it is related to your stress levels or the anxiety levels also. So this blood pressure is called white coat hypertension. That is, after this, there's a term called white coat hypertension. That is, once you reach a OPD clinic and you see a doctor, your blood pressure spikes up, and this is actually not actual hypertension. And patients are, they do not have the hypertension, and they are having a normal blood pressure at home. So now various guidelines, they say that we should also do a out of office readings, that is a home BP monitoring, to rule out this out of white coat hypertension. And there is also a term called masked hypertension. It is relatively less common, and it is seen that the patient, sometimes they have a normal blood pressure in the clinics, but once they go home or they're doing some activity, their blood pressure shoots up. This is called masked hypertension. Again, home blood pressure monitoring is very important to diagnose both of these problems, because the treatments are different. In white coat hypertension, we do not treat with drugs aggressively, but if there is a masked hypertension, we have to treat with drugs if the blood pressure is remaining high. So again, it would seem desirable that we should have an optimal blood pressure in young and middle-aged patients. Now I'm coming to the goal. What is the target blood pressure which we should focus? The target is for all the patients, whether young or old, 130 by 80. What the various guidelines say are the range is between 120 to 130 systolic, that is the upper blood pressure, and between 70 to 80 diastolic, that is the optimal blood pressure which we can have, and that is the best for our body. But if you can even if the lower is better, because it has been seen that once our blood pressure becomes more than 115 systolic and 75 diastolic for a long time, the risk of complications increase. But our target should be around 120 to 130 systolic and 70 to 80 diastolic. We should know these numbers and we should remember these numbers. And the patient with stroke, who have already suffered a CVA, that is a hemiplegia, the patient has a weakness of one side of body, or any other history prior it has happened and now recovered. In those patients, the target is 130 by 85. We can maintain the lower blood pressure at around 85 also. And in the old patients, like the octogenarian, nanogenarian, the patients who are more than 80 years old, the targets are slightly high, that is 140 by 90. And are all the drug strategy, we should try to aim our blood pressure to these values as much as possible. Now, coming on to the lifestyle modifications, that is how we can manage our blood pressure with the lifestyle modification, that is no drugs and only with the without any medications, how we can try to bring our BP down, especially for the low risk population, because in India, many of the young population is having hypertension. They are relatively low risk and they can easily control blood pressure without the medicines. So these few things are very important. One of them is dietary changes. What dietary changes? One is salt reduction. We should have less than 6 gram of salts in a day. Then is moderation of alcohol consumption. So what is moderation? Moderation is we should not have more than 2 drinks, that is 230 ml of alcoholic beverages more than 5 days a week. So it should be less than that of a consumption. Diet of high in fruits and vegetables, whichever the seasonal fruits are there, whichever the vegetables are there, we should focus on having more of these fruits and vegetables, and less of added sugars and saturated fats. This is also very important, because many of our Indian diets, many of our, especially North Indian food, is full of added sugars and saturated fats. Especially now, the fast food culture which has come up, most of the things, they have added flavors and they have added tasteners, and they have a lot of added salt as well as added sugars and saturated fats, and these are actually harmful for your body. So now, coming from the lifestyle, then is the activity. How much activity is important? For a normal person, I suggest at least more than 10,000 steps in a day, and there should be at least 30 minutes of aerobic exercise. Aerobic means you can either do a high intensity cardio workout, you can do swimming, you can do cycling, and it should be of that pace. that you have some exertion. You should not be able to talk with another person while you are doing this exercise, and it should be done at least 5 days a week. So this is the minimum required aerobic activity which we need to decrease our blood pressure. And last but not the least is the stress reduction. Stress is one of the major factor causing increased blood pressure, especially in young population, because of the job situation, because of financial reasons, and there are multiple reasons are the stress occurs. And the reduction of stress by various means like yoga, meditation, all of them actually helps to bring down your blood pressure. And it is very important to keep these stress levels low by all these activities, whether it's counseling, whether it's more of mindfulness exercise. You can follow multiple various things, your hobbies, music, all these things can help you bring down the blood pressure. Now coming on to the another point, that is how to adhere to these antihypertensive treatment. The problem with the antihypertensive management and the fear among people with who are being started with that we will be put on these medicines indefinitely, and in Punjabi they say sanu dawai lag jayegi, but this is not right. Actually, if you take these medicines indefinitely to keep your blood pressure low, it will actually prevent you from developing complications later during your life. And some patients, they become bedridden, they become burden on the society just because they have not taken care of their body in their young ages, and they have just ignored themselves. And so we should be very cautious about all these things, and we should be literate about our body. And because as I said, these diseases do not produce any symptoms, and taking a medicine for something which you do not feel anything actually is sometimes difficult. But poor adherence to these medications actually leads to complication. And we have it, there is a lot of data which shows that there is risk of heart attacks, risk of strokes, risk of kidney problems, risk of eye problems. All these things can be easily controlled if we keep our hypertension under control initial stages of our life, and we can prevent this so-called target organ damage. So therefore adherence is very important, and it is the main predictor of hypertension outcome and complication. So then is, if you are taking hypertensive medication, how long we should follow up, how should be our follow up. So if you are a young hypertensive, as I said, you can easily follow up after 3 months if your blood pressure is under control and your goal has been reached. Even after 1 year you can make a follow up if you are, everything is doing fine and you are a young patient. But if there is a high risk situation, like someone is suffering from a heart disease, or someone is having a history of stroke, or someone is having a very uncontrolled blood pressure, you can make an early visit. But once it is controlled, you can have a 3 to 6 monthly visit easily. Then the last point which I want to discuss is home blood pressure monitoring. Now there is a lot of evidence and a lot of guidelines. They suggest that we should incorporate home blood pressure monitoring. Everybody should, whoever has having a blood pressure problem in their family, they should keep a home blood pressure device. These electronic devices, some of them are WHO recommended devices. They are available on the site of WHO, so you can order one of these devices. They are available in a country, and you can also check through the blood pressure devices at home. So which is very important, because as I said, you can diagnose white coat hypertension and masked hypertension, and it further helps to prevent cardiovascular risk. And whenever the last point is, whenever we are checking for blood pressure, there are few important things which we should be keeping in mind. One is, we should not be having any physical problem when we are checking blood pressure. If you are having pain, your blood pressure will be high. If you are having exertion, you just came from exercise, you check your blood pressure, it will be high. You should, if you have had coffee, or you have smoked, or you have a big meal before, like 10 minutes or 15 minutes before, your blood pressure will be high. So all these things should be taken care before you are checking blood pressure. You should be sitting comfortably with your legs which are supported, and your back should be supported by a chair. Your arm should be resting, and you should check your blood pressure in both the arms after the gap of 30 seconds or around 1 minute. And then your reading will be actual, because blood pressure is not, will not remain constant. It is a continuously changing thing. But if your blood pressure, when you are comfortable and everything is fine, is still coming on the higher side, then you need to do something about it. And that's all the things which I have said. And that will be all from my side. I hope some of the points will help you in your further management of hypertension. And thank you for giving your precious time.